Good morning friends. Today we will discuss about the blood pressure from B.SC. third year class, paper number 2, Mammalian Physiology and Endocrinology. In previous lecture we studied about the circulation. Today we discuss about the blood pressure. What is mean by blood pressure? The hydrostatic pressure exerted by blood on the wall of blood vessel is called blood pressure. Blood pressure is the force exerted by the blood against the wall of blood vessel. The blood pressure is measured in terms of systolic and diastolic blood pressure. Systolic blood pressure two types. First is systolic blood pressure. This systolic blood pressure is force exerted by arterial walls during systole. It is the maximum pressure during ventricular contraction. Next type is diastolic pressure. In this pressure, the force exerted by blood against arterial wall during diastole condition. It is maximum pressure when the ventricles are relaxed. The difference between these two pressure is called as pulse pressure. Difference between systolic and diastolic pressure, it is called as pulse pressure. And normal blood pressure is about 120 to 80 mmHg. Here systolic pressure is 120 and diastolic pressure is 80 mmHg, and pulse pressure is about 40 mmHg. Pulse pressure is about 40 mmHg, and normally the pulse pressure is 40 mmHg. The blood volume increases, pressure exerted against arterial wall also increases. In hemorrhagic condition or bleeding condition, blood volume decreases, automatically blood pressure decreases. This blood pressure is measured in millimeter of mercury, that is mmHg. This blood pressure is measured in terms of millimeters of mercury, that is mmHg. Blood pressure basically depends upon cardiac output and the peripheral vascular resistance. Blood pressure is equal to cardiac output into peripheral resistance, peripheral vascular resistance. Here cardiac output is stroke volume into heart rate. Next point is factors affecting on the blood pressure. Different factors affects on the blood pressure. First factor is age. This age, in different age groups, different blood pressure present. Blood pressure varies throughout the age. As age increases, blood pressure also increases. At birth, blood pressure is about 70 to 90 to 40 mmHg blood pressure present at the birth. At the Adult condition, normal blood pressure ranges between 120 to 80 mmHg present, and during the older age systolic pressure rises with decreasing elasticity. Body size, second factor is body size. It is also called as obesity. Body size increases, blood pressure also increases, and blood pressure fluctuates. Heavier and taller child having higher blood pressure than the normal child of the same age. Next factor is diet. Diet also affect on the blood pressure. People taking diet rich in salt intake also increases blood pressure. Next point is smoking. In this smoking, nicotine is present, and this nicotine increases blood pressure. Next point, exercise. During exercise, blood pressure also increases, but during exercise, this exercise helps keeping the BP in normal condition. Diurnal variations, usually person having low BP in early morning and gradually rises and peaks in evening. Medication, certain medicines, these are anti-hypersensitive drugs, have greater effect on the blood pressure. And last point is chemicals. Different chemicals such as antidiuretic hormone ADH. These ADH, epinephrine, these causes vasoconstriction, thus elevating BP, and histamine causes vasodilation, thus decreases BP. This BP, when normal range increase or decrease, such disease forms, it is called as hypertension and hypotension. In low BP, high blood pressure, it is also called as hypertension. When a condition in which the force of blood against the artery wall is too high, and these usually hypertension is forms, and during hypertension normal blood pressure range increases above 120, these are 140 to 90 mmHg, these ranges increases, and during this high blood pressure, risk factors for many diseases including heart disease, kidney failure. Next point is low BP, low blood pressure, it is also called as hypotension, and in this condition normal BP range is also falls below the normal range, that is 90 to 60 mmHg. Normal BP range is below the normal range, and this low BP makes feel tired and dizzy. Next point in our list is measurement of BP. Here two methods are used for blood pressure measurement. First method is direct method, and second method is indirect method. In this direct method, the method is surgically applied, and this artery is exposed, and the pressure is measured using a mercury manometer. A cannula is inserted into an exposed artery or vein or heart, and the other end of the cannula is connected to U-shaped mercury manometer. Here in direct method, surgical operation required but indirect method here surgical operation not need, and this pressure is measured without any surgical procedure. In this method, the pressure of brachial artery is measured using an instrument, and this instrument it is called as sphygmomanometer. This instrument is called as sphygmomanometer, and this sphygmomanometer directly applied to the brachial artery, and this instrument used in clinical instrument used for the measurement of the blood pressure. This is all about the blood pressure. Thank you.